there is truth about HIV care we don't talk about often enough. We made it manageable, but we haven't made it easy. We have suppressed the virus, but we haven't silenced the burden. Yes, we have powerful medicines. Yes, most people living with HIV can live long, healthy lives, but they still live with HIV every single day. And for healthcare professionals, you know what it takes: drug resistance, comorbidities, adherence challenges, psychosocial stress. This is where we are. But what if the next chapter of HIV care isn't just about more drugs or fewer pills? What if it's about smarter, more human, more predictive care powered by AI? In this video, I want to show you how far we've come, what patients are still telling us they need, and how artificial intelligence, when used wisely, might help us get there. We are in the most successful era of HIV treatment the world has ever seen. ART has transformed HIV from a terminal illness into a manageable condition. We start treatment immediately, and most patients achieve viral suppression. U=U is not just a campaign, it's a clinical reality. By 2023, over 30 million people were on ART. 93% of them had their virus under control. We've made HIV clinically silent in many, but for the person taking medication every day, it's still very present. Ask patients, and they'll tell you what viral load tests don't show. I'm healthy, but I'm tired. I take my meds, but I still feel like I'm positive. Will I ever be free of this label? This isn't just about managing a virus, it's about living a life. Many report treatment fatigue, even with once daily pills. Others face stigma silently, and navigating fragmented systems makes it harder. They want more than viral suppression. They want relief from the weight of the condition. And as healthcare professionals, we feel that too. We want to offer more, but we're working with limited time, limited data, and a system that reacts more than it predicts. This is where AI comes in. AI, or artificial intelligence, is already reshaping medicine, and HIV care is no exception. Let's define it clearly. When we say AI, we're talking about computational models, often machine learning, that analyze large data sets to find patterns, make predictions, and guide decisions. Let's start with diagnostics. HIV self-testing has opened doors, especially in rural and resource-limited areas. It's private, accessible, and fast. But the real problem is reading the result. A faint second line, poor lighting, and a nervous user unsure of what they're seeing. Even trained professionals can disagree on the result. And in remote settings, there is no second opinion. That's where AI steps in. In rural South Africa, researchers trained AI on over 11,000 real-world images of HIV rapid tests. The system ran on tablets, no extra hardware, just a camera and app. When compared to traditional visual interpretation by nurses and community health workers, the AI was consistently more accurate. 97.8% sensitivity, 100% specificity. It reduced the false positives from 11 to 0 and false negatives by half. Importantly, all users, regardless of training, were able to use the app successfully without additional instructions. This means someone testing alone, far from a clinic, gets a trusted second opinion, which is accurate, private, and it's scalable. Now, on to treatment and monitoring. We often assume that once someone starts ART, the job is done. But as any clinician knows, adherence is fragile. One missed dose, one skipped refill. By the time the viral load rises, resistance may be developing. Or worse, the patients may have dropped out of care. That's because our system is still reactive. We find out someone's not adhering only after the viral load spikes. But what if we could predict trouble before it starts? In Uganda, a study followed over 1,300 patients using smart pill bottles. Over months, the device quietly collected adherence data, not just if a dose was missed, but tracked dose timing, consistency, and changes. Then AI models analyzed the data. The goal was to predict who was likely to experience virological rebound without relying solely on routine viral load testing. The outcome was powerful. The AI models identified patients with risk of viral rebound with such accuracy that researchers proposed a major shift. Reduce the number of viral load tests for stable patients, cutting costs by up to 54% while still flagging those at high risk for timely intervention. Now this changes everything. It means we can move from blanket lab testing to targeted, data-driven care, from catching failures late to preventing them early, from wasting precious lab capacity to directing it where it matters most. Elsewhere, in Mozambique and Nigeria, national HIV programs are now integrating AI-based risk scoring systems using routine clinical data like missed appointments, age, CD4 trend, social vulnerability factors. These models identify which patients are most likely to disengage from care before it happens. Instead of treating every patient the same, AI allows clinics to focus resources where they're needed the most. The patient who's starting to disappear, not the one who's already lost. Now, let's talk about something even more ambitious. AI as a partner in choosing, improving, and even inventing treatments. Right now, if the patient's virus mutates, resistant testing helps guide the next step. But those interpretations, they are based on existing mutation tables and expert guidelines. AI, on the other hand, offers something more powerful. In one study, AI models trained on 55,000 viral genomes identified 6 new drug-resistant mutations missed by traditional methods. This means if a patient's HIV strain carries an unusual mutation, AI could now help predict whether it will make certain drugs less effective and suggest better alternatives. Tools like these are already being explored by companies like IBM Research, alongside academic labs, and even offered in some clinics as cloud-based services. But AI isn't just interpreting resistance, it's creating possibilities. In the lab, AI models are now designing new antiviral compounds, testing molecules virtually before they're even made. One deep learning system recently predicted several new HIV enzyme inhibitors, molecules no one had thought to try. That is not just theory. Some of these compounds are now candidates for synthesis and testing. This is the new frontier. AI as drug designer, resistant analyst, and treatment strategist. And it means that whether you're a clinician choosing a regime or a patient hoping for fewer pills, fewer side effects, or personalized care, the future is getting smarter fast. But not all challenges in HIV care are biomedical. Some of the hardest battles are human. Loneliness, stigma, confusion, mental health struggles that no lab test can detect. Here too, AI is beginning to make a difference. In Montreal, researchers created a 24/7 chatbot called Marvin. It wasn't flashy, but it could answer real questions from real patients. What do I do if I miss a dose? Can I drink alcohol on my meds? Why do I feel this way? Patients in the research reported that it felt safe, non-judgmental, and always available. And in the quiet hours when no clinic is open, that mattered. This is where AI shines, not replacing healthcare workers, but extending them. A chatbot like Marvin can reinforce adherence, deliver trustworthy answers, and offer support when no one else is around. And the future versions, they will be even smarter, able to sense distress, respond empathetically, and connect patients to human care when needed. But AI isn't stopping at chat. Smart apps can now detect patterns of missed doses, mood changes in messages, or gaps in clinical attendance. and intervene gently. In Kenya and Canada, even simple AI-driven SMS systems, not full chatbots, have improved adherence and viral suppression by checking in weekly and adapting their messaging. And when it comes to stigma, AI is helping behind the scenes. In Nigeria, AI scans social media for stigmatizing language and misinformation. It then works with influencers to change the narrative. In clinics, it helps providers speak more empathetically. AI listens, learns, and reminds people that they are not alone. And then there is public health. In Kenya, predictive models analyze clinical data and identify where new infections are rising or which communities are falling behind in treatment. This then allows sending mobile clinics, PrEP, or outreach exactly where they're needed. In Uganda, AI estimates the size of hidden high-risk groups like adolescent girls. That data helps reach them before they're missed. Even something as seemingly mundane as stock management is getting smarter. AI tools help forecast demand for HIV meds and testing kits, ensuring no patient is turned away because the shelf was empty. And in South Africa, AI cleaned up National Health Database, deduplicating over 20 million records. The result? A more accurate picture of care, better funding decisions, and fewer patients lost to poor data. This is precision public health. Fewer gaps, fewer delays, fewer people left behind. So, where is all this heading I heard you say? Let's fast forward just a few years. Imagine this. A person newly diagnosed with HIV gets more than a leaflet and a follow-up appointment. They get an AI-powered health agent, a virtual assistant on their phone, trained in HIV Care, always by their side. It doesn't just remind them to take their meds, it checks in, like, how did you sleep? It listens, like, you mentioned nausea, want to talk about it? It knows their routine, their risks, their preferences. And when something's off, missed doses, a worrying symptom, a change in voice tone, it gently nudges them or alerts a real clinician. This isn't science fiction. It's already being prototyped. Companies like Google, Apple, and Babylon Healthcare are building intelligent assistants that could soon become co-pilots for chronic care. And for clinicians, AI will soon pull together genetic data, adherence history, comorbidities, mental health scores, and create a dashboard that predicts not just viral suppression, but long-term health outcomes. Which drug will this patient tolerate best? How likely are they to stick with a daily pill versus an injection? What's their cardiovascular risk in 10 years? AI will know, and not in vague trends, in actionable, individualized guidance. That is precision medicine. Fewer one-size-fits-all decisions, and more, this is right for you decision. And at a population level, AI will predict where HIV might flare up next, down to neighborhoods and social networks. So prevention can strike before transmission spreads. This is the final phase of epidemic control: smart, targeted, and proactive. In future, we will not just react to HIV anymore, we will outpace it. We began this journey decades ago, first with fear, then with hope, then with science. Today, AI doesn't just replace our human care, it amplifies it. It sharpens our vision, extends our reach, listens when we're too busy, notices what we might miss, and reminds us the future of HIV care isn't just about new drugs or tests. It's about making care smarter, more personal, and more equitable. And it's already happening. So, whether you're a clinician, a policymaker, or someone living with HIV, this future isn't far away. It's arriving, and it's ours to shape. That's it for today, everyone. If you like this video, please like, share, and subscribe to my channel. It helps this channel, this movement grow. Until next time, stay safe, folks.